This Good to Go segment is sponsored by Corewell Health.
1 in 8 women in the U.S. will develop breast cancer during her lifetime. Having an annual mammogram starting at age 40 is the first step toward finding breast cancer early. Thanks to advances in medical technology, there are now additional methods of screening for breast cancer. Dr. Jennifer Johnston is a radiologist at Corewell Health, here to tell us more about these screening tools. Hi, Dr. Johnston.
Hi, how are you?
I'm well, thank you. Most women are familiar, obviously, with mammograms, but why is it important to have one?
So mammograms are our primary tool for identifying breast cancer. It's widely available, it's cost effective, and it's the only imaging modality that's been shown in large multi-center trials to decrease the risk of women dying from breast cancer.
About half the women in our country have dense breast tissue. Why is that a concern?
So it's important for 2 reasons. One is that dense breast tissue reduces the effectiveness of mammography and also increases the risk of developing breast cancer. Increased breast density is an independent moderate risk for the development of breast cancer and can mask underlying breast cancer on a screening exam, which is particularly important for those women with extremely dense breasts. That masking can result in an increased interval cancer detection rate, meaning you have a negative mammogram, and then within the year before your next mammogram, a cancer is detected. And those cancers are typically more aggressive, higher stage breast cancers, and have worse prognosis.
For many years, women at high risk have been encouraged to have breast MRI, but what's available for women who are at average risk and who might want more than just a mammogram?
So breast MRI is a great tool, but has been reserved for those women traditionally who are in the high risk categories. So up until recently, ultrasound is the only alternative supplemental screening tool that we have available for women with dense breast desiring a supplemental screening tool. More recently, at Corewell Health, we've implemented an abbreviated breast MRI program to offer to those average and intermediate risk patients who desire supplemental screening.
And what is that abbreviated? What does that mean?
So abbreviated breast MRI is similar in the significant sensitivity it offers for the identification of breast cancer to the traditional MRI. However, it is done with significant reduced series of images, which results in a decreased scan time, which allows us to make it a more affordable option for patients who are not covered by insurance to receive.
Okay, so who is the prime candidate for this abbreviated breast MRI?
So any woman who is in that average and intermediate risk population is available and could have abbreviated breast MRI. The specific population that we're targeting are those women with increased breast density, either classified as heterogeneously dense or extremely dense on their screening exam. And they should receive a letter in the mail when they have their screening exam that will let them know what their breast density is. And the reason we're particularly targeting this patient population is because they have that risk of masking a small breast cancer on their mammogram. So this would offer them an additional tool to detect it early.
Any drawbacks?
So there are a few drawbacks, which are seen in any imaging modality. You run the risk of having false positive results. There's also the administration of gadolinium contrast, which some people have some concerns about. At Corewell Health, we do use a gadolinium agent that has shown to have reduced or minimal deposition in the brain. There are no studies that have shown that causes any long-term effects. We know that it exists. We don't know what that means or if that has any significant health impacts, but we are aware of it and have made steps to minimize that deposition in patients who desire MRI screening.
All right. Well, we want to let folks know where they can find more information. You can visit spectrumhealth.org/ABMRI. ABMRI. Dr. Johnston, thank you.
You're welcome. Thanks.